Hi, I'm Alex Crossley. This is my examination video of the hip and groin. So I'll just start by introducing myself, as I have, and gain consent from my patient. Is it okay if I examine your hip and groin today? Would that be okay? And we'll go for your right side. Do you have any previous problems with either of those?
No.
Okay. So I'll start actually by examining your back, if that's okay. So if you turn away from me, so I'll just have a look and check for vertebral alignment, any previous scars, any gross bony abnormality, any rashes. And check for the normal cervical lordosis, and then the thoracic kyphosis, and then the lumbar lordosis again. You can also have a look at the scapula, but everything seems to be fine. And then if I could just have a look at you, if you could just walk away from me, and then turn around and walk back towards me. Thank you. We're just going to do a Trendelenburg's test now. So if I get you to face me and hold on to my hands, and lift one of your legs up, just looking at the pelvis to see if the affected side would drop, but it doesn't, and just do the same on the other side. Okay, that's fine. And I'm going to test your sacroiliac joint in your back. So in a minute I'm going to get you to turn around, I'm going to hold onto your back, and I'm going to get you to lean back into me, push yourself forward like that, okay? So if you lift your right leg up, and just lean back in towards me and push your pelvis forward. Okay, and just do the same on the other side. Any pain there at all?
No.
Okay, that's fine. So I'm happy with the back, and I've taken the opportunity to look at the sacroiliac joint there. So if you'd like to lie up on the couch, that'd be brilliant. So I'll now just inspect the area. If we just straighten this leg, so just pop that up. In an ideal scenario, the patient would be a bit more exposed than this, but for the purpose of this video, the patient isn't. So just have a look for any obvious swelling in the groin or the hip area, any bursitis, any previous scars, hernias, anything like that that appears abnormal. I'm just going to have a feel into your groin now, if that's okay. So just palpate the groin itself. Just cough for me. Okay, just check for hernias, just feel for the femoral pulse, and check it's equal on both sides and in time. And then feel the bones, so starting at the ACIS. Work your way around, greater trochanter, the inferior iliac spine, pubic tubercles, sorry if you need to wee. Any of that painful at all? No. Okay, so now we can look at range of movement. So if I start off by asking you to keep your knees straight, and if you just lift your whole leg up, that's fine. Any pain there at all?
No.
Okay. So that's a good way of looking for sciatic nerve impingement as well, if that was eliciting pain down the back of the leg. If you just bend your knee for me, and just put your knee up to your chest, that's fine, and then straighten it up again. And then if you bring your leg out towards me as far as I'll go, so abduction, and then back over the other way, adduction. Okay, for internal external rotation, you can log roll the leg, but that's not particularly effective. So the best way is to flex the knee, and then if I get you to put your knee towards your other knee, so external rotation, and then this way, internal rotation of the hip. That's fine. Okay, so done a range of movement. Now it's probably useful just to do a quick neurovascular exam and check power. So again, if I get you to try and straight leg raise, I'm going to try and resist you. Okay, so that's testing the quadriceps. And then if you bend your knee, and then try and put your knee up to your chest, that's more iliopsoas. Keep going against my hand. Okay, that's fine. And then if you try and squeeze your legs in together, the adductors, and then pull them apart. Okay, that's fine. Would you be able to roll onto your tummy for me, if that's okay? So if I can get you to, we'll stay with your right leg. If you can keep your legs straight and lift it all off the bed against me, that's fine. So that's hamstrings, and then bend your knee, and then again lift your leg towards the ceiling. So that's more gluteal muscles. That's fine. You can roll back onto your back now. Thank you. It's probably worth doing Thomas's test now. Look for a hip flexion contracture. So if you can bring both your knees up to your chest and hold onto them with your arms. Okay, and then you keep hold of this one. I'm just going to release your left leg, and we're looking to see if it gets down to the bed. Have you got a hip flexion contracture, have you? This patient's leg is slightly off the bed, but to my knowledge, I don't think they have a hip flexion contracture. Just take that leg back and do the same on the other side. Okay, that's my ankle. That's fine. So I'm going to now just check the patient's iliotibial band. So if I can get you to, for the purpose of the video, we'll do your left leg. So if you roll towards me, onto your side and keep your leg straight, I'm just going to let this leg drop down behind, and that's a normal finding, and that should be able to, if we stabilise the pelvis as well, that leg should be able to fall behind the other one. If the ITB was particularly tight, you'd find that that leg would stay up there. Okay, that's fine if you roll back onto your back again. You can test for sartorius by asking them to, if you place this heel onto that shin and then bring it up towards your knee. Is that painful at all? No. No? That's fine. And then if you'd just like to, last time, roll onto your front again. Just to palpate the posterior joint properly. Sometimes if it's piriformis impingement, you can elicit that. That's fine, you can roll back onto your front. Last couple of things just to check for a potential labral tear. They say that that's meant to be found at extremities of range of movement, which we've already assessed. So I'm just going to take my hands and support your leg here. I'm just going to feel into your groin, and I'm just going to move your leg. If you've got a labral tear as well, have you? I've picked a good patient. So you move the leg in sort of extremes of flexion, extension, bend the knee, and see if you can feel a clicking or a catching. Sometimes can suggest a labral tear. That concludes my examination of the joint. I just finished by just checking your pulses in your foot, dorsalis pedis, which I can feel. I'll just check popliteal. And I'm just going to check your sensation. So I'm just going to touch your leg, and if you can tell me if you can feel it or not. Okay, so work your way down from say L2 to S1.
Yeah.
Like that.
Yeah. 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 Yeah.
And can you just bring your two big toes up towards your nose, and then push them down, and then bring your whole foot up, and then push them down. That's fine, that concludes my examination. Thank you.